Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I am thrilled to have Brandon Laws here with me today for this episode of Ask the Patient Advocate podcast. In the current age of healthcare, it is important to have an advocate to help navigate for you and your loved ones. And part of advocating is having the proper resources to support your diagnosis and management. And so sometimes we like to ask some clients of ours to come on and sort of share their experience and, help explain their condition and their struggles. And so today I have Brandon, who is one of my long-term clients, and we have been helping him navigate his healthcare since 2022. And Brandon's parents initially contacted me with concerns about Brandon's rare medical conditions and explained that they were seeking help because they really felt that they had hit a wall and really didn't know where to turn to. So I want to introduce Brandon first. So hi, Brandon. Thanks for joining. How are you doing today?
Hi there, Elena. I'm doing okay considering. As somebody at the store just asked me yesterday how I was doing, I said I'm alive, so that's good based on all that's happened over the past almost 6 years now.
Sure. It's been a long struggle for you, I'm aware. And it's great that you are able to, really have a positive outlook on things most of the time. So I think that's really important. But why don't we start by asking a question that I think will be helpful to our listeners? Brandon, when you first started working together, or when we first started working together, you had a known diagnosis of akathisia and malls, and then we later confirmed your diagnosis of EDS, or also known as Ehlers-Danlos Syndrome. Can you tell our listeners a little more information about your situation and how you got diagnosed with akathisia, which is a condition that is still not very well known or understood in the medical community today?
So there's a few questions there. There's malls, akathisia, Ehlers-Danlos. The
I would specifically, talk more. You can touch on whatever you'd like, but I think the biggest one that's maybe a little bit more unknown is the akathisia.
Yeah. Okay. So I guess I should backtrack a little bit, describing what happened that caused the akathisia to begin with, which will actually lay out some of the Ehlers-Danlos in the process. I got injured by a chiropractic recommendation for a massage for side effects that were gastrointestinal, and the condition that the chiropractor thought I had turned out to not actually be what I had. So I did this massage and it injured me, not knowing I had a connective tissue disorder, which is why it injured me so severely. In the process, I lost my ability to sleep deeply, and I had to start sleeping vertical. After sleeping vertical for I don't know how long it was, it could be weeks or months, it had just been a nonstop struggle, close to 6 years now. And I decided to go to the ER after a while from having to sleep sitting up and not getting good night's rest, and 3 days in or so of just absolutely no sleep at all. I was screaming literally just because not sleeping just causes horrendous side effects. So I said, okay, I'm going to the ER. I didn't want to, but I did. And I go into this ER and I talk to the doctor and say, hey, I'm struggling to sleep. Is there anything you can give me? And he brings out a benzodiazepine. I didn't know too much about those at the time, but I knew enough to know that medications had side effects that I should be concerned about. So I broke the medication into pieces, trying to take low doses, just waiting for an effect from the medication. I didn't want to take more than I needed. And the doctor got really frustrated with me, not liking that I was doing that. He said I'd give more to a baby, take the full dose, or get out of my ER. So I ended up taking the full dose, which wasn't too much. It was probably like 2 or 4 milligrams of Ativan, although technically I believe that is quite a large dose. And so I went home, and on the way home, my hands started getting numb, feeling like cotton, and my perception of reality went from, it's hard to explain, you'd have to see me. My hands are facing in front of my face. So my perception of reality was out that way. And then my perception of reality as the medication kicked in brought my hands closer in, as if I started becoming in a tunnel vision. So the side effects started pretty much right away, but I went home and I was sleeping sitting up and I fell asleep. And so that was a win for me after not sleeping for days. And so I decided to just keep taking the medication. But unfortunately, that turned on me a couple weeks, month in maybe. Out of the blue, I started groaning really, really loud. Horrible groaning, loud enough for the neighbors to hear and call the police loud. And next thing I know, that turns into my body moving uncontrollably and me being a complete emotional wreck and breaking things against my will as well. And so this goes into, well, what is going on? All I knew at the time, I was calling my friend while groaning and screaming. And I start yelling, "It's the pills, it's the pills." That's all we really knew. My mom starts researching online because I was in too much of a vulnerable state to do so. And luckily, she figured out pretty quickly that it was akathisia. Some way, somehow, she stumbled on it very quickly. Um, Probably because the symptoms were just so obvious. And then from there, this is where it gets a little bit confusing is the diagnosis was kind of on and off. Some doctors were acknowledging that I was having it, and then other doctors were quite negligent. I would argue to medical malpractice degree, to where they would say, "Oh, he's just bipolar or psychotic." And technically, akathisia causes some forms of psychosis, but um, it's kind of arguable that it's not necessarily that type of psychosis that should be diagnosed. It should just be called akathisia. And so some doctors said, sure, he's having akathisia, and then others said, no, he's bipolar and psychotic. And so then I had these conflicting results, but we knew what it was, so we just continued to persist. Excuse me. We knew what it was, so we continued to persist in the truth. And eventually, doctors started agreeing that it was akathisia, and not these other mental health conditions that they were claiming at that time. Yeah, so that's kind of the akathisia story. And then you actually got involved, I don't know, maybe a year or two later that I was having akathisia.
That
Uh,
sounds about right. Yeah.
and it was just, even then, once I was diagnosed, it was still pretty messy for us to try and get managed, trying to find doctors to agree that it was akathisia for the most part, got it diagnosed. And then since akathisia has internal restlessness and it's not always external, and it also has the neurological side effects which make you look bipolar, when in fact it's just actually akathisia. Sometimes it's hard to get diagnosed that way. And so, long story short, you ended up helping me go to see a doctor at U of M, and thankfully, I was having some outward appearances of akathisia. I've always had outward appearances, but it's always at random because of the exhaustion from Ehlers Danlos Syndrome, so it's not consistent with movements. And so he saw me having tardive dyskinesia while I was visiting him at the appointment, and then I showed him videos of the akathisia. And since he was a movement disorder specialist, he actually agreed that it was akathisia, although he wasn't educated on the severe neurological side effects of the condition. So that's the long story short of the condition there, I guess.
Yeah, no, that's super helpful. It's a lot, of
Yeah,
course,
yeah.
but it's a great, I think you summarized it very well. Now, my next question, which is also a very rare disorder, can you briefly tell our listeners what MALS is?
Yeah. So Malls is median arcuate ligament syndrome. And for anybody that's not really into the medical language, that probably makes no sense to anybody. That took me a long time. So median means middle, and I just had to double check this. And arcuate means an arc, and then
Mhm.
ligament, and we all know what ligaments are. And so median is pretty much it's a ligament in the center of your abdomen, just coincidentally right where I had that massage injury from the chiropractor done. And this ligament is constricting on an artery that feeds blood flow to the stomach. And that artery, with that compression, causes severe, severe pain and restricted blood flow. The pain at times can be considered equivalent to pancreatic cancer pain, which has been mentioned from the mall support groups. I've had it to that extent at times, and it's quite painful. And it leads to people needing to be on feeding tubes and other things like that. There was a time when it would have been preferable for me to be on a feeding tube, but with all my food allergies, it was impossible to do so. So, Moll's, long story short, is a condition that compresses an artery and causes severe, severe pain while eating, and it's something that I wouldn't recommend having.
Yes, I have experienced the struggles that you've had and the severity of the symptoms with related to malls. So, I've seen how difficult that condition can be. So, as far as your experience dealing with the Ehlers-Danlos syndrome, or EDS, the akathisia, and the malls, how has all of that affected your daily life and your overall health? I know it hasn't been positive, of course,
No, it's
but
not.
you know, give us a little bit more insight, like on a day to day, what you've been experiencing, or how that's affected your day to day activity.
I like the way my Ehlers-Danlos syndrome specialist summed it up for me
Mhm.
when we visited her. I think you were on the phone. She
Yeah,
looked at me, and this is right after the physical eval. She saw that I was having cervical instability, and we talked about the slipping rib syndrome and akathisia and the malls, nutcracker syndrome, and all these other conditions that are considered comorbidities with Ehlers-Danlos. And she looked at me and she said, "This is not very difficult for me because I'm not the one that has these conditions. But you, on the other hand, are going through these. And I can only imagine going through even just one of these, let alone all of these conditions." Uh,
sure.
so, suffering from Ehlers-Danlos has been completely debilitating, 20 hours a day bedridden. And then when I am up, since it's causing sleep deprivation, every moment's just pain, physical pain with the sleep deprivation. A lot of people have mentioned to me, they sleep deprive people in the military and they sleep deprive prisoners and terrorists, and you're going through that, and you're just a citizen trying to live his life. And so it's been very difficult in that regard. So I ran a YouTube channel and I was just starting to grow on it, and it reached like 3,000 subscribers recently after being idle on it for years. And so it took that away. It took my ability to consider having a spouse away. It took my relationships from great with people to close to not, excuse me. It took my relationships with people from good to close to no contact because I had just been suffering so much. There was really no room for me to even have relationships, even with people in my own home. And the relationships that I was having, a lot of it was running around pacing with akathisia or curled up in a ball in pain with the malls.
Now, what about the akathisia? How has it impacted your well being, specifically like your emotional well being? I know that it's played a huge toll on that.
Yeah, so akathisia, I still don't understand why. I'm probably going to sound like a broken record. Doctors only know it as a movement disorder, but we know from the publications that it's so much more than a movement disorder. It causes a hyperactive brain. It's not just a depletion of dopamine specifically. I got to be careful how I say this. I'm not a doctor. It's from what I've experienced and what hundreds of other people have experienced. It's not just a depletion of dopamine that makes you move. It's literally speeding up your brain in every way, shape, or form that you could ever imagine. Um, and typically in the form of like extreme terror. Everything feels like the end of the world. um, your head spins. I don't even know how else to explain it other than your head spins, and it causes what you would think would be anxiety. At first, you think it is. You're like, oh, I'm pretty anxious today, and then out of the blue, it just becomes, you're sitting there and your whole body's moving, oh, and you're just struggling to breathe, and you're like, oh, I'm having a panic attack. But then it escalates even more than that and becomes so much more than just a panic attack. And you're like, okay, wait, what's going on now? And so with akathisia, and kind of lost my thought on your question here, but I'll try to finish what I was
I,
saying.
you're doing a good job. I had asked about the like emotional impact
Yeah.
of it. Yeah.
So you have all these symptoms where you just can't function at all. And it causes so much emotional dysregulation because your normal life is completely taken from you and your normal thought process is not there. No longer are you thinking linear. It's more like these ups and downs and these fixations on just the end of the world type of fixations. So you just become a complete emotional wreck. And anybody with akathisia would understand what I'm talking about.
That's a lot. So now typically if you have a medical condition or symptoms, you know, you were taught to seek expertise and experienced professionals in that area of study. So healthcare professionals, right? So what has been your experience since you've been diagnosed with healthcare professionals while managing these conditions? Like, what specific challenges have you encountered? And, working with you, I know that you've encountered quite a few,
Sure.
but I just thought it'd be important for you to maybe share some with our listeners.
I was looking up in a dictionary and I even tried using AI to kind of pinpoint down a good definition for the struggles. And I came to the conclusion that there are so many biases that you actually can't pick which bias it would be. Maybe it would be survivor bias or authority bias or, just something along those lines. But then suddenly it just became a bias in general that the doctor had from this is what I was taught in school, therefore it is. But with all these conditions that I have, they're rare conditions and not many people are researching them. And we know that there's pharmaceutical leverage financially, unfortunately. So at times there's been pride, which you've witnessed with that pain management doctor, to where he was boastful about what he thought he knew about akathisia, where he said people with akathisia don't end up in psych wards, they end up with the neurologist. And as you can tell, that was my neurological side effect, but he was wrong about that. So with that being said, it typically comes down to either there's biases or there's a major education gap. And people with Lyme disease and other rare conditions will know what I'm talking about. It seems like with conditions like Lyme disease, everybody's 10 years ahead of some of these medical professionals that we're supposed to trust. So, as an example, they'd say take 2 weeks of antibiotics and you'll be good. And it's like just now catching on years later that people are on antibiotics for months and sometimes years for the condition. And so it's really the same with these as well. I would say it's just my conditions, but it's really multiple medical conditions, not just mine alone. And so with the experts, you have to almost, it's kind of hard to explain. It's almost like dating. You have to find the right expert. It really is. It's really
I really like that analogy or that comparison. I think that's quite accurate. I haven't heard of that before.
yeah. Yeah, it's like, you have similar interests and other interests that you don't like very much, and things you agree on, or things that you don't agree on. And with the way research is going these days, it's like which side of the research are you going to believe in versus not? And
Sure,
stuff.
sure. No, that's a good way of explaining it. So, what advice would you give someone who might be in a similar situation, um, such as like struggling with akathisia?
Similar situation. I'd say first off, this isn't going away right away, and that's probably not the best thing to say right away. Um, but there are people that understand, obviously, such as Elena. Elena listens. There are doctors out there that listen. In the Ehlers Danlos community as well, there are doctors that listen. They even acknowledge on their bios as medical professionals that they're listening when the other doctors really aren't. So I would be extremely patient to try and find somebody. And especially with akathisia, you're going to have to really build a muscle of patience and a muscle of endurance and literally just start bouncing around from doctor to doctor until you find one that sort of understands. You're never going to find one that's perfect, but if somebody is willing to keep you alive, then focus on staying alive, literally. And so for me, that entailed running from doctor to doctor, waiting to find a doctor that I felt comfortable with, that I didn't believe would hurt my life, possibly even take my life, really, if you think about it. And then going into finding a patient advocate, thankfully somebody recommended looking for one. And so I found Elena in the process. And Elena was a really big deal for me because when you're having akathisia, you can barely speak and you're pacing and trying not to break things at times, depending on the severity of the condition. And when you're at hospitals, nobody recognizes it for whatever reason, even though it's not a rare condition. It's like what 22% of people get the condition. So having a advocate during emergencies to me has been so crucial. There have been times when Elena has saved me from being drugged and misdiagnosed. There was even a social worker that was like, "Oh, this is bipolar," and I'm like, "You're a social worker and you're going to diagnose me, even though everything's already documented." And so Elena ended up calling, and maybe an hour later on the phone, I'm assuming, the social worker walks back out and doesn't look at me and basically rolls her eyes. And so having somebody that knows what the condition is going to be very, very helpful. And in particular, I'd recommend somebody that's an advocate that is a medical professional, or is very close to becoming a medical professional, so that there is respect in the industry. And that's where Elena was very, very helpful. So patience, endurance, and finding people on your side. That's really all you can do at the time, and everything you can that you can think of to stay calm and survive.
Oh, thank you, Brandon. That was really helpful, I'm sure, to our listeners because sometimes, or I think there's such benefits of hearing it from somebody that's actually gone through it and, has experienced what it's like when they're in the hospital and trying to get people to listen and trying to find a provider that they can establish with that's going to actually take them seriously and give them some kind of, you know, next steps and things like that. So it's been so helpful to have you here to share your experience. Now, I know from working with you that you have some social media followers that follow you throughout your journey that you share. Can you share with our listeners what that is?
Yeah, so before I got injured, I was close to obsessed with herbalism and natural health. And that's because I had some mild health issues before all this, and probably because, there's Ehlers, Danlos, and other health issues involved. And so I started learning about herbs and supplements on my own, and I just really enjoyed the research. And I thought it was nice that there was a way to have some control over my health. And so I decided, okay, well, in the process of doing this, maybe I should share what I'm learning with people. And so I started making videos on herbal supplements, like rhodiola, and even some things outside of herbal supplements, such as activated charcoal, just basically anything that seemed beneficial. Um, One way of describing it is superfoods and super herbs. It's like the supplements that will give us the most benefit versus, lower grade supplements, that people could spend thousands of dollars on and not really get much benefit out of. So it was my main focus on my channel to find what had been working for a lot of people and seeing if it would work for me. And if not, at least I have all this information available. So I made YouTube videos sharing with people the information I learned and started a channel called Brandon's Health Journey. And that's eventually some of my videos would reach up to 40,000 views, just hundreds of thousands of views on my channel, and not many subscribers, but a lot of support, surprisingly. And a lot of them actually helped keep me alive too, as well. So my YouTube channel is based around my appreciation for health and God's creation and herbal supplements and nutrition in general. But since my health got taken down, I'm not on there too much. But yeah, I still love YouTube to this day. It's one of the greatest things ever, honestly.
That's really important. It's great that you do take the time to share your story because, it's helpful. It's helpful for and comforting for people to know that they're not the only ones out there they're not experiencing something that no one else has. I think that's really important to have that support and whatever guidance that they can get, even if the experiences aren't exactly the same because everyone's different, of course. But just finding some shared similarities, I know, is very comforting. Brandon, thank you so much. It's been such a pleasure to have you on, sharing your story. And I definitely foresee us asking you to come on again in the future. And, I it's been, I look forward to continuing to work with you and making progress throughout your journey. But thank you so much. I really appreciate it.
Yeah, if you don't mind me just saying one last thing,
Sure.
there's a statement that you said that we may not have the same conditions, but there are
Mhm.
similarities. And that was one of the biggest things that I noticed, especially once I started talking to you, is that there's nothing new under the sun when it
Sure.
comes to the medical system. So there's literally a process of seeking out specialists and finding answers to your medical conditions. And it's just a matter of, like I said in like I said earlier, it's a matter of patience and following the process and treating things like you're dating or you're an attorney and being very specific about these conditions. And once you realize there's nothing new under the sun, and really think about what that means, and you look at your health situation, you're like, oh, okay, there really is a process to this, and I just need to follow this process and follow this, essentially a game. That's kind of a way of looking at it. And so I would highly recommend looking at it as that is, there's nothing new under the sun. And even though you might not have the same condition as me, you will have a very similar process. The only process that would be different is when you'll be diagnosed and how long you'll have your condition.
That's great. Thank you so much, Brandon. So, again, thank you everyone for joining us today. And thank you, Brandon, for allowing all of our listeners to meet you. Please reach out to Brandon or myself for further questions and enjoy the rest of your day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.